everyone, and welcome back once again to Renegade Healer. I'm Kate Mooney, and this is a series of conversations that I am trying to offer as a way to share my experience in healing, most specifically healing from post-concussion and post-concussion syndrome, but sometimes just healing in general, and some thoughts and ideas that come from my experience in mental health and the healthcare system in general. And today specifically, that's the focus of this post. So if you're used to sort of tuning in and watching or listening with a specific mind for head injury recovery, hopefully this conversation will be useful, but I also hope that it will be very useful to a lot of other people. And I think probably I have a lot to say, so it might be the first of a few segments. Essentially, what I want to talk about is healthcare and the system, or what we refer to as the healthcare system. And the reason I want to do this is because there are a lot of misunderstandings and expectations or assumptions that lead us to make mistakes in being good patients and self-advocating, and also lead to a lot of frustrations. So something that I'm really passionate about is giving people good information, not as a point of trying to criticize our system, but as a point of trying to help you make really good decisions about navigating the system and be what I would call a very effective patient. One of the first mistakes that we make is that we view doctors, nurses, and practitioners as people who don't have the right to make mistakes. We sort of treat them like they're subhuman. I don't think any of us do it on purpose, but being a patient is a very vulnerable time, emotionally, mentally, physically. We don't have a lot of stamina or patience when we're ill. So mistakes that other people make or inconveniences that arise, we tend to react fairly harshly. And we forget to treat the people who are caring for us as just humans. We can be snappy, we can be overly critical, and just generally kind of difficult to work with sometimes, all of us. And I think there's a really important point that we have to consider, which is that in most places, certainly in my area geographically, our healthcare system and the workers in our healthcare system are under a terrible strain. It's a healthcare system that's under a lot of pressure, and in most people's opinions, it's in crisis. Financially, manpower, system change, you name it, there's a lot happening. Now, should we be frightened by that? Maybe, but there's not really any useful use in getting upset and frightened. But if we are conscious of it, then that can be useful. So, first step in being an effective patient is recognizing that you and the person that you're dealing with as a caregiver, no matter how well you're getting along, you're actually on the same team and trying to accomplish the same thing. You're both trying to achieve the best result for your healthcare as quickly as possible. But it's not always within your power, and it's not always within the other person's power either to move quickly, whether that be because of processes, policies, privacy issues. There's so many layers to it. But we have to stop thinking about the person in front of us, the caregiver in front of us, as an adversary or somebody who's not doing their job effectively. Because what happens is that that kind of criticism and interaction is really fatiguing on you as a patient, but also on your caregiver. And given that they are just human, being asked to work in an environment where they're kind of being abused for things that are not their fault constantly, it causes burnout. And you don't get the same quality of care from somebody who's burned out. So what we need to do is be really compassionate as patients. We think of the compassion as being one directional. We're the one who's sick, so therefore the person dealing with us should be patient, forgiving, kind, compassionate to us. But if we can give that same courtesy back to them, then we all win in the long run. So maybe that seems like maybe a little bit condescending, patronizing advice. I don't mean it to be. It's just kind of one of those things, in my opinion, that's common sense, but commonly overlooked and forgotten. So I wanted to put it out there. The next piece, the next mistake that we make is thinking of our healthcare system as a system and assuming that information is flowing fluidly and effectively in a timely fashion from one caregiver to the next, whether it be test results or consult notes or whatever. We have this mental image, most of us, that somehow or another all of our doctors are talking, sharing information back and forth, reviewing the information, and by the time we come into the office, they know what's going on with us. We get very frustrated with asking questions and having to repeat the answers to the same questions more than once. In my own experience, I've had people say, "Oh, don't you people talk to each other?" And the truth is, no, often they don't, often we don't. And we have to stop viewing that with criticism. Just like any other workplace, the healthcare system is running hard and fast, and there's just not enough time in the day to do everything the way most people would like to do it, the staff included, because very few people go to work and think, I want to do the bare minimum today. Most people go to work and they want to do the very best work they can. But the challenges and limitations of the system don't always let them do their work the way they wish. So we have to stop assuming that people have time to stop and read a report, and that the report's going to be sent right away, because there may be a backlog. There may be that this person is falling behind on their notes and has to catch up. It may be that this person has another patient with a more critical situation, which is definitely true if you're relying on your local emergency room as your primary care provider, which is the case for many people. We'll get to that in a minute. Bottom line is our system, our healthcare system, has a lot of problems. There's a lot of people working on fixing those problems, but they're complex because of privacy, confidentiality, technology. They're complex problems. So the flow of information is clunky and slow and not always at the same pace, moving at the same pace as our actual health issues are. So in order to be an effective patient, we have to be responsible for helping that flow of information be efficient. Anybody who's been following my posts would know that I am a big stickler for routine and self-advocacy, and I often will recommend that you keep some sort of a journal. And if in that journal you are also tracking information about your symptoms and your experience, but you also jot down the names of doctors that you interact with, their specialty, any tests that they might order. When you go to a doctor's office, ask them if they need you to sign a release of information, any of these kinds of things. Just jot these little things down, and maybe if you don't trust yourself to remember to ask, just write the questions in your agenda. And each time you go to an appointment or you interact with somebody, you flip open your agenda and you ask these questions and you date it. By doing that, when you are in touch with your healthcare provider, or if you don't have a healthcare provider and you are having to deal with your local emergency room, you are able to say, here are the doctors that I have been in touch with and who have seen me. Here are the tests that were ordered and on what day. Yeah. And then somebody can help gather that information and sort of create a little hub, a little well, they can start to, somebody can kind of take the lead on making sure your information is landing in one place, okay? But somebody needs to make that start, and in a lot of cases, you need to help it along, okay? So letting go of the assumption that everything should and will flow smoothly, and recognizing that our healthcare system is struggling, and because it's made up of a bunch of human beings doing the best they can, there are going to be mistakes made. It's a waste of energy, and it's making your health worse to get angry, to criticize. It's better to just accept and then try to help it along, okay? Because I'm trying to keep this brief each time, each segment, I'm going to make one more point, and then I'm going to pause and come back for another segment. In my geographic area, a ton of people are without a primary care doctor or nurse practitioner. They have nobody. So they have to utilize the local emergency room as their primary point of care. This means that often people will be sitting in the emergency room because they have the flu, or they've had a migraine for 2 days, or they have a deep cut on their finger. And our local hospital has made a lot of efforts to adapt for this situation because they recognize that it's a big problem. But their solutions are not perfect. And mistakes happen, or even things that you would not call mistakes, but just things don't always flow perfectly. Each time that I am required to go to the emergency room, either for what I think is an emergency or because I don't have access to my doctor, I hear the same conversations. People will sit and they become very angry and negative about the length of time that they've been sitting. Sometimes people get very aggravated with the staff, and often people will get up and just leave. And of course it's frustrating, it's difficult, and of course you have the right to leave the hospital, but it bothers me because it's failing to recognize the reality of the situation, which is they're not a primary care facility, they are a hospital. They are there as an emergency room for emergency cases, and they are challenged with having to decide who to see first, which they do based on the severity of the symptoms and the possible risk of a negative outcome if the patient isn't seen quickly. That changes moment by moment depending on whether who walks through the doors, whether ambulances bring in sick people, which doctors are on duty, how fast they work, what tests need to be ordered, so many variables. And that's right, because that's the nature of the emergency room. I hear people complain about doctors and nurses taking their lunch breaks because they've been sitting in the emergency room for 6 hours and there's a big lineup of people waiting to be seen, and how dare they take a break and go take their hour lunch or whatever, or a nap, when there's so many people sitting and waiting. And that troubles me because I think, first of all, human beings, they need a break. They need to rest. They need to eat. And even if we're not being kind, considerate of their human needs, if we're forgetting that they're human because we're human, for your own sake, in order to be an effective patient, you should be thinking about what state your caregiver is in when they're dealing with you. If a doctor is working a 10 or a 12-hour shift, especially a night shift, you want them to take those breaks. You want them to be well hydrated, well rested, and fed so that they can give you the best possible care, so that they are not making mistakes when they see you, because they can make mistakes. And I think that needs to be said out loud, and I think we need to start a conversation amongst ourselves about changing our attitude towards these types of what we consider to be inconveniences, because in the long run, it's putting pressure on our caregivers that causes greater inconvenience. The state of things in our healthcare system is tough, and if patients are making it tougher by failing to be understanding, failing to offer compassion, and being impatient and argumentative, why would anybody want to go in healthcare? and what kind of attitude and energy are existing healthcare providers expected to maintain? We could all argue that, well, you're a professional, you get paid enough, you should be able to pull it up, step up to the plate. But first and foremost, they're human beings. So this is just the start of what I want to be an ongoing conversation about how to be an effective patient. And I guess maybe the theme of this little segment is how to be an effective patient by breaking the habit of placing all the expectation on the care provider and taking some responsibility ourselves, but more so also offering some of that caring back, just person to person, and trying to foster a more positive environment where people will feel that they can work more effectively and cooperatively. So just sit with that, and we'll come back again, and I'll continue building on this topic. And I would sure love if ever there was a segment that I would love to see people sharing and talking about. This would be the one. So consider to like and subscribe or share through your social media, and we'll see you again soon.